And you know this area so well because, among other things, you actually were a co-founder of WebMD as well, something we all know about. Yeah. Explain to us what exactly is going on as tech meets healthcare right now. What's the transformation we're watching?
Well, I think even 20 years ago when we started WebMD, we thought health needed a homepage. There needed to be a destination where doctors and patients could go that wasn't so fragmented. Back then, just getting health information not from your doctor was a big deal. But with all these other industries being disrupted, hospitality, transportation, financial services, smartphones being so pervasive now, why can't healthcare be next? And so this idea of all your health in one place where all the various stakeholders are coming together, health plans, providers, large employers, to empower consumers to take control of their health, to reduce healthcare costs is I think the timing's now.
Jeff, we've been hearing about this for some time, and it certainly makes good sense that people wouldn't be keeping scraps of paper and big files and things, and yet we don't seem to be getting there. What's the resistance? What's between us and really having an electronic way to access all of our healthcare data?
Yeah, I think it's the consumer taking control. Now we have a smartphone, we have a common platform that we can develop to, but instead of the hospital saying, you, my patient, come to my portal, and the health plan saying, you as my member, download my app, it's now about, can you create a health profile on behalf of the person and use the technology to bring the stakeholders to that person's hand.
Oh God, those portal apps kill me every time. I'm like 17, oh my God. Yeah. So if you talk about tech and healthcare, the first thing's going to come to your mind is Amazon, Berkshire Hathaway, and JP Morgan. Yeah. What do you think they're going to do for the industry?
I think they're creating a catalyst for change. So, all the incumbents have, woke up and said, we have to embrace technology, we have to embrace consumerism, and we need to do things differently. I think the winner in the space is who's going to be able to manage the data, right? So you have self-reported data, device-driven data, claims-driven data, social determinants of health data, and medical records. It's also going to come down to who can drive engagement, who can get the person to actually take that first step and take control of their health. And then lastly, it'll be awareness. How do these new platforms make people feel?
When you talk about all that kind of data, we're pretty sensitive in general about our healthcare data. Yeah. How are you going to guarantee that it's not going to be hacked or it's not going to be shared? Because we have a lot of digital companies right now who are under siege, most recently Facebook.
Well, I think in health, trust is paramount. So what we try to do at healthcare is try to build you a health profile similar to how LinkedIn's your business profile, but empower the consumer to own their data. So the health plan doesn't own the data, the PBM doesn't own the data, the health EMR system doesn't own the data, the person does. The person controls the permissions, so the same way they can turn on and off Wi-Fi, they can exchange their medical records. So trust is everything, but I think us breaking through and saying it's not the insurance company that owns the data, the person owns the data. If the person changes health plans, the data goes with them. If the person changes doctors, the data goes with them.
But you got to protect it. What do you think the threat is? We're going to see some federal regulation on big tech companies, and that would encompass something that you do.
Well, I think, outside of trust and transparency, protecting the data is, rule number one. And so we're embracing, the best practices, blockchains and other technologies to try to lock down this sensitive information. But it's a concern everybody has in the industry.
Could regulation actually help you as you develop your business in the sense that it would reassure the consumers out there that actually there is some protection?
I think so. And I think having standards that all this fragmented data can talk to will help not only make the platforms more robust, but build more consumer confidence.
So what do you make of Mark Zuckerberg going to Capitol Hill over the next 2 days and facing Congress? Like, how do you think that plays out in that industry?
Well, I think that people are so used to using these social platforms. It's become such a daily way of life that the train somewhat has left the station. But I think it's all about transparency. I think people want to know, what are you doing with my data? And then people can make the choice. Do they want to share that information or not? Are they willing to pay for premium services, or is this going to be ad-supported? But I think all the facts are going to need to be on the table.
It's not just about convenience and accuracy, it's also about cost overall. Yeah. We've got a problem in this country as an increasing percentage of GDP is healthcare. Will your approach, if it becomes the standard, will it bend the cost curve?
It will bend the cost curve. And so we talk a lot about engagement and how does the application make you feel, but the key objectives are, how do you make people more self-aware about their health? How do you reduce risk escalation? How do you not overuse the emergency room? How do you optimize provider networks to get the right person to the right doctor? How do you help people with pharmacy spend, which is out of control? Moving from branded drugs to generic drugs, from retail to home delivery. We can get to people on their smartphones at the right moment to help them make better decisions in how to control their health care, which is ultimately going to reduce cost.
What's the biggest health care increase that you can take out? The biggest health care cost that you can help us take out?
Well, I think, there's a lot of areas because there's about 8 key objectives that we work on. And at the first is making people more self-aware about their health in general. And we want to keep the people that are healthy, right? So we don't want them to turn into chronic patients for us. Disease management and lifestyle management, I think you're going to see a revolution there. It's almost going to be as if Siri or Alexa was your coach. So instead of somebody sitting in a call center trying to manage you remotely, it's going to feel to that person like you're being coached 24/7. And so as all this data and AI and machine learning starts to take shape of your health, you're going to be in control like you've never had before.
So finally, what's the biggest advantage you have? Because you're up against some pretty big players out there, big pharma, big PBMs, big healthcare organizations. How could you get an advantage?
So we think ours is everybody talks about being disrupted. We think that we want to be disrupted but not disenfranchised. So how do we work with the big health systems? How do we work with the big health plans and help them understand the consumer and bring their data to the palm of that person's hand? That's where we've thrived to date, is working with these big organizations, helping them come into the consumerism age.